The diagnosis of ulcerative colitis is typically entertained in people who come to medical attention because of the symptoms of bloody diarrhea and cramping abdominal pain. Those symptoms overlap with other conditions that need to be excluded first before coming to a diagnosis of ulcerative colitis. The conditions that need to be looked for initially include infections in the intestine, so-called infectious colitis, a period of time where there is too little blood flow to the intestine, ischemic colitis, or conditions that result from radiation being used, so-called radiation colitis. Once those have been excluded, the diagnosis of ulcerative colitis is confirmed using an invasive test called colonoscopy. A colonoscopy is a test where a thin tube that has a light and a camera at the end of it is placed into the rectum for a variable distance into the colon. It allows the investigator to look inside the colon at the wall of the intestine and look for changes that are characteristic of ulcerative colitis, including bleeding and breaks in the lining called ulcers. Biopsies are also taken during the colonoscopies. Biopsies are small samples of the lining of the intestine. These are sent to the pathology lab for examination and may reveal changes that are consistent with ulcerative colitis, thereby clinching the diagnosis.